Eileen, Veilleux The Fam here. Welcome to the final installment in our mini mental health series on Digeorge syndrome. And in this installment, we will be covering the diagnosis and treatment of Digeorge syndrome. But before we begin, let me just remind you to watch the full video because in the video, there will be 3 key words that I mentioned. When I get to the keyword, I will say keyword and then what that keyword is. So watch the full video, and then at the end of the video, along with a genuine comment about the video, put in the 3 keywords that you heard to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's begin. Well, how do you diagnose Digeorge syndrome? Well, a diagnosis of Digeorge syndrome is usually primarily based on keyword lab tests that can detect the deletion in chromosome 22. Your doctor will order this test if your child has a combination of medical problems or conditions suggesting Digeorge syndrome. A heart defect, because certain heart defects are commonly associated with Digeorge syndrome. In some cases, though, a child may have a combination of conditions that suggest Digeorge syndrome, but the lab test doesn't indicate a deletion in chromosome 22. Although these cases present a diagnostic challenge, the coordination and care of the medical, developmental, or behavior problems will likely be similar. So how do you treat Digeorge if your child has it? Well, just remember first of all, there is no cure for Digeorge syndrome. Treatments can usually correct critical problems such as heart defects or cleft palate. Other health issues and developmental mental health behavioral problems can be addressed or monitored as needed. Treatments and therapy for Digeorge syndrome may include interventions for hyperthyroidism, which that can usually be managed with calcium supplements and vitamin D supplements. Heart defects, most heart defects associated with Digeorge syndrome do require surgery soon after birth to repair the heart and improve the blood supply. Limited thymus gland function. If your child has some thymic function, infections may be frequent, but not necessarily severe. These infections, like colds and ear infections, are generally treated as they would be in any other child. Most children with limited thymic function follow the normal schedule of vaccines. For most children with moderate thymus impairment, immune system function improves with age. Severe thymus dysfunction, though, is the impairment of the thymus is so severe or there is no thymus, your child is at risk for a number of severe infections. Treatment requires a transplant of thymus tissue, specialized cells from bone marrow, or specialized disease-fighting blood cells. Cleft palate. A cleft palate or other abnormalities of the palate and lip can usually be surgically repaired. Overall development. Your child will likely benefit from a range of therapies, including speech therapy, occupational therapy, and developmental therapy. In the United States, there's plenty of intervention programs providing these types of therapies and are usually available through your state or county health department. As far as the mental health care, treatment may be recommended if your child is later diagnosed with attention deficit hyperactivity disorder, better known as ADHD, autism spectrum disorder, depression, or other mental health behavioral problems. Management of other conditions. While these may include addressing feeding and growth issues, hearing or vision problems, and other medical conditions. Now, before we begin, let me just point out that if your child has poor eyesight at a very young age or has hearing problems at a young age, Don't rule out anything else. It could be other things. Just because they have some of these, or even if they have ADHD, it does not mean that they have Digeorge syndrome. There are other things that can cause it. Okay? Now, for the healthcare part of it, because Digeorge syndrome can result in so many different problems, several specialists will likely be involved in keyword diagnosing specific conditions, recommended treatments, and providing care. This team will evolve as your child's needs change. Specialists on your care team may include these professionals and others as needed. A pediatrician, a geneticist, a cardiologist, immunologist, a ENT, otherwise known as ear, nose, and throat specialist, infectious disease specialist, hormone disorder specialist, a surgeon who specializes in correcting such conditions as cleft palate, surgeons who specialize in correcting heart defects, occupational therapist, speech therapist, and developmental therapist, along with mental health. So you can see with a child that has Digeorge, there's a lot involved in them, and I would highly suggest parents, family, friends, relatives, anybody involved in the care of the child to keep involved with it. Ask the doctor questions, the therapist, be involved, learn what you can do to help that child to be the best that they can be. Because having a child with Digeorge syndrome is, keyword, challenging. You must deal with numerous treatment issues, manage your own expectations, and meet the needs of the child. So make sure you ask your healthcare team about organizations that provide educational materials, support groups, and other resources for parents of children with Digeorge syndrome. Okay, because it's very important. With any mental or physical disability, the more involved you get, the better. My youngest son could possibly have Digeorge syndrome. When I had him, there was no testing for Digeorge. He doesn't have heart problems, but he was born with a kidney problem. They did suggest that he is autistic. He does, we talk on a regular basis. He has a lot of mental health issues, a lot of physical issues with diet and everything else. But I want to say, my son, like when he calls me, he's a grown adult now. When he calls me, like he called yesterday, and he wanted me to know that he took second place in the Special Olympics competition. As a parent, a friend, or a relative, if you have somebody with somebody with Digeorge syndrome, don't take anything for granted. Any little thing that they accomplish is a big milestone for them. So remember that. That's like when my son called me and he told me he took second place. I let him know I was so proud of him. I was happy. And even if he came in fourth or fifth or lower than that he was still a winner in my eyes because he did the best that he could do. And that's what they need. They need encouragement. Everybody, whether they have a mental handicap, a physical handicap, a no handicap, we all need encouragement from time to time. So remember that. Understanding, encouragement, lift people up, don't bring them down, okay? Getting back to this, I'm just going to read over this and show you on the picture when you check out someone with Digeorge syndrome, you may notice that the person will have some problems, like his or her heart will have a disease. Their brain has a problem where he or she has learning difficulties. Remember that. It's not that they don't want to learn. It's they have learning difficulties because of their brain not working the way it should be. Okay? Or the most easiest way of telling, you can check out the person's facial features and see if they have any problems with their mouth, eyes, or ears. And here's an example. They show you the eyes here are close to the nose. Okay? And then they show you the bridge. And then they show you the problems. You can see they have them all underlined. All of them here. So these are the things that you can look for if you think a child has Digeorge. Now remember, don't automatically assume. If you think your child has Digeorge, make sure you get it tested. If you have a friend that has a child with Digeorge, they need your support as well. Because as you just learned, it is hard for them to manage their expectations of their child, the treatment for that child, their regular life with job, work, employment, other children in the family. There's a lot on their shoulders when you have a handicapped child. So keep that in mind, okay? That's why it's so important, and I emphasize this with every video, to see with your heart and not your eyes. Because when you just see with your eyes, you're missing what matters. Because the only thing that truly matters is invisible to the eye. Because it's in here. The eyes cannot see through skin. The eyes cannot see a person's soul. They can't see their personality. They can see the outcome of the personality. But to understand, you need to see with the heart. The heart is what sees more than the eyes. The eyes are deceiving. Like I said in another video, you take like a walnut. The shell of the walnut looks perfect. You're hungry. You feel like having a walnut. Well, you look at that shell and it's like, oh, wow, I can have me a walnut because that shell looks so good. You crack open the shell. You look inside the shell. And there's the nut. Well, the nut still looks good. You take a bite. Oh, that's rotten. Something happened. But the eyes deceived you because you seen the shell. So you thought the nut was good because the shell looked good. No holes, nothing. It looked perfect. So your eyes deceived you. You don't know until you crack open the nut. Well, it's the same thing with people. Our eyes can deceive us when we look at somebody from the outside. When you look from the heart, it's like you're cracking open that shell to see what's inside. So always remember to see with the heart and not with the eyes. And until we see each other again, remember, I love you. Yes, every one of you out there. I love you. You are important to me. You matter. Why? Because you were made the way you were made. And nobody out there, and I mean nobody, should try to change you. True love is like that of an animal. It's unconditional, which means you take people for who they are. The good, the bad, and the ugly. That's friendship. That's love. Not putting any expectations on people. Because we are who we are. And when we try to change for somebody else, we become miserable because we're not comfortable. It's not who we are. So don't ask anybody to change. Accept who they are. If you have a problem with something, say, look, I know you're joking about this or that, but I appreciate it if you could be a little lighter because it's bothering me because of such and such and such and such. Don't ask them to change. Let them know how you feel, and then they can deal with it better. Don't go and talk behind your back and talk to somebody else. Because when you do that, your story gets twisted. Be genuine. Be honest. Be loving and understanding. Just like you want them to be honest, loving, and understanding of who you are and what you're going through. So until I see you again, I love you all. Bye.